Hi, I'm Angelina Salazar, Vice President of Outreach and Communications for Western Healthcare Alliance, and we've been exploring this thing called volume to value. In the first part of a three-part series, we looked at what population health is. In the second part, we interviewed Connie Mack and learned about the role of the CFO. In this third part, I'm interviewing Director of Operations for the Community Care Alliance, Marnell Bradfield, and she's going to talk to us today about looking outside the walls of your hospital.
A key to any successful population health program is to start to collaborate with partners outside of the hospital, whether that be your own primary care clinic, if you have a rural health clinic or a primary care clinic that you own, collaborating with members and providers, staff within that organization, and then starting to move out into the community and partnering with churches, transportation, all kinds of community partners in order to affect a population's health and their wellness, more importantly, their wellness. I think it starts with identifying who those partners might be. Looking at the needs of your patients. There's a catchphrase, the social determinants of health, and I think it's a really important and often overlooked piece of population health are those social determinants. Medicare has some statistics that say 80% of a person's well-being or their overall health is determined by things like transportation, their ability to get food, their ability to pick up their prescriptions, and only about 20% of that care is actually clinical intervention. And so I think just identifying what your patients or your population needs and then going out in your community and seeing if you have those resources through a church or through a transportation organization or even your local library or Meals on Wheels, and then partnering up with those organizations to be able to deliver care to your patients. Within a primary care organization, oftentimes it is part of the team, the care team, and if you're fortunate enough to have a care coordinator, often a care coordinator, but some programs or some communities have health navigators or community health workers, and all of those staff are well trained in identifying community partners. It starts with forming a team. If you're fortunate enough to have a primary or rural health clinic as part of your organization, getting people from that clinic onto your hospital team. It could be a quality team where you have a practice administrator and a provider, both from the hospital and from the primary care, but really being able to start to think about workflows and processes for not only acute visits, but for wellness care, things like annual wellness visit, getting patients in before they need to be seen and addressing their health issues. That's how you really affect a population.